Hey guys, it's Jamie from Little Bear, and today I want to talk to you more about VBACs, and I want to talk to you about being a good candidate for VBAC or Vaginal Birth After Cesarean. So, if you know me, you know I don't like the term good candidate. I don't like rules. I don't like words like proven pelvis or TOLAC, trial of labor after cesarean. Um, I don't like those words when we're talking about VBACs, but what I'm going to do today is I'm going to tell you what the medical community kind of goes off of and what their perspective is. And then I want you to do what you do best, and I want you to gather information and use your brain to make a decision for yourself. Make a decision that's best for you and your family. Is that a good disclaimer? Okay. I'm trying to take a lot of my emotion out of these videos, and I find that I have a lot of emotion. And so I'm going to be neutral as much as I can. And I support you making whatever decision you make, but I don't like people being bullied into a decision because some doctor feels the risk is too high for them, that they don't think the mother should make decisions about what risk she's willing to take. So that's where I get mad. I get mad with words like TOLAC because I feel like this trial of labor is like, oh, well, you can try for a VBAC. We'll see if it happens. I don't like that attitude. I like to have a very positive, like, we're doing this attitude. And, I believe in flexibility. I believe in realism, but I also believe in having a positive attitude and believing in yourself. I think language matters and words matter. So I'm totally going off on a tangent right now, and I'm really sorry, guys. But the other phrase I hate is proven pelvis, and I'm going to use that phrase today, and I hate it. I think it's disgusting. I think saying that you have a proven pelvis is like saying because you had a C-section, you haven't proven yourself of something, like you're not worthy, and I think that's bullshit. So I'm going to go ahead and use some of these disgusting words that they use, and then just to kind of give you a heads up on what they think a good candidate is. And then I'm going to let you do your own research and realize that there are mothers out there who have had a successful VBAC at home, even with big babies, even, or breech babies, even after multiple cesareans. So there are people who defy all of these rules. And I just want to say that straight up. I don't want you to feel like I'm telling you that if you don't meet this criteria, you aren't a good candidate for a VBAC. But that's what some people might try to tell you. So I want you to know that this is just information. Information for you to weigh, information for you to be aware of. All right. Let me finish my 3-minute rant and talk to you about being a good candidate for VBAC. So a perfect VBAC candidate would be somebody who has had only one, maybe two cesareans, who has a proven pelvis, which means they've had a previous vaginal delivery, and has a low transverse scar on their abdomen. And the pregnancies or births are spaced about 12 months, births spaced 18 to 24 months. That is the perfect situation for a perfect VBAC, whatever that means. But you might be thinking, okay, I've only had one baby and it was a C-section. I don't have a proven pelvis. Does that mean I can have a VBAC? Yes. Did you have a VBAC? The reason you had a VBAC, this I think, is really worth exploring the most is the reason you had a VBAC. If the reason you had a VBAC was something like you had a breech baby, then spoiler alert, you can have a vaginal breech birth. I learned that after I had a cesarean for breech presentation. If that's not up your alley, that's fine too, but just because you had one breech baby doesn't mean you're doomed to have more breech babies. My first was breech. My second two were not. So I had 2 VBACs. Would I have attempted a VBAC with a breech baby? Yeah, I would have. I would have found a provider to support that. And if I couldn't have, then I would have figured out a solution. But that, after my research, is a risk that I would be willing to take. I would be willing to have a breech VBAC, yes. I think a breech baby is a stupid reason to have cesareans for the rest of your life. Actually, my OB who did my cesarean told me that. She literally was like, we're going to do everything we can to make sure you have a good VBAC, because a breech baby is a stupid reason to have C-sections forever. And so doctors who don't support a VBAC and the whole reason you had your first cesarean was because of a breech baby, they're idiots. Yeah, sorry. This one makes me emotional. This one just makes me emotional. I'm just gonna say that. Can you have a VBAC with a big baby? Yes, you can. During my third pregnancy, I had to see an MFM, which is maternal fetal medicine specialist, because I was a VBAC. Like, I didn't have to see an MFM with my first VBAC, but with my second VBAC, I had to see an MFM, whatever, new city, new state, new rules. Okay. I went to see this guy, and he told me that I could only have a VBAC if my baby was in a perfect position, my baby was not big, and it was done in the hospital. She was 10 pounds, 4 ounces and born at home. So, yeah. If I had known she was that big, they would have tried to tell me that I couldn't have a VBAC, that it wouldn't be possible. It was. Okay, so again, breaking all the rules. Let's talk about scars. This is a good one. If you have special scars, there was a good Facebook group for special scar moms who wanted to have a VBAC or whatever. Here's the deal with special scars. A transverse low scar, that means it goes across the lower part of your belly. It's not an up and down scar. It's not an inverted T scar. It's just the transverse line across your lower belly. That is considered the gold standard for having a VBAC, because I guess it creates the least damage and you are at the least risk for uterine rupture. Once you start getting the special scars, which is the classic scar, which is the vertical scar, or the inverted T, I think there's a J scar they have, those scars do have an increased risk of uterine rupture associated with them. There are not many studies done on this because it's just not done that often. So how are you going to construct a good, solid study when it's something that's just not done? That being said, it is not impossible to have a successful VBAC with a special scar. There are people who have done it. It's up to you to decide if maybe depending on your scar type, instead of a 0.8% chance of rupture, you might have a 2% chance of rupture. Are you okay with taking that 98% chance of not rupturing? Maybe. Maybe that's not a good deal for you. Maybe you're not comfortable with that. Okay. It's going to be hard to find a provider who's comfortable supporting that. That, I will be honest with you, that's going to be hard because ACOG doesn't support a VBAC with special scars. So we talked about reason for cesarean. I talked about breech. I kind of just went on a rant with that, but there's other reasons that you might have had a C-section. You might really be hesitant to go for VBAC because your C-section might have been one of these two reasons. You may have been told that you had failure to progress, or you may have been told that you had what's called CPD, or cephalopelvic disproportion. It basically saying your baby's head is too big for your pelvis, or your pelvis is too small for your baby's head. Both of those reasons do exist. Both of those reasons do exist. However, they are not as common as they are diagnosed. Sometimes they are an easy label to slap on something that could have just been labor mismanagement. And that's going to be something for you to learn about and read your records and discuss and talk through with somebody. But people who believe that they don't progress in labor or that their babies are too big for them to birth are often very hesitant to attempt a VBAC. And what I have to say to you is it is still very possible for you to have a VBAC, and I think you need to do some reflection on your birth experience and kind of figure out if there were things that could have just been done differently, if the situation could have been handled differently. Failure to progress, we like to say, is actually more often failure to wait. If there was not an emergency, being stuck at 5 centimeters for 5 hours does not necessarily mean that you don't dilate. It could mean there was a lot going on. You were stressed out and you weren't able to get into a good labor pattern. Or there's so many different things. Your baby could have been in a bad position and you may not have been moving in positions that helped your baby shift. And that's not your fault. There might have been nobody to say, hey, maybe your baby's in this position. Maybe we need to try getting in this position to encourage baby to move into a more optimal position. There's just, it really comes down to how was your labor managed. If you can reflect on that and you find maybe we could have done things differently, then you very well may be a great candidate for a VBAC. I planned on coming into this video with like 4 criteria for having a VBAC, or like 4 what makes you a great VBAC candidate. But as I'm talking about it, I'm like getting more frustrated at like this whole term of like, am I a good VBAC candidate? Like, you know what? You want to have a VBAC? It's important to you. You know how you can have a good VBAC? You know how you can be a good candidate for a VBAC? Educate yourself about birth. Find a supportive provider. Like, understand what's happening with your body and how you can work with that process instead of against it, and have a provider who's supportive of that. And if you can't find that provider, well, that's a different conversation for a different day. But like, all of these rules, all they are guidelines, really. They're guidelines. And you have a brain and you have a right to access the information that says, this is an increased risk, but this is what the risk is. Repeat C-sections come with increased risk too. When you have 3, 4, 5, 6, 7 C-sections, yes, there's people who have them. You have increased risks. Not everyone's going to have a bad experience. There's going to be people out there who have 8 C-sections and love their C-sections, and that's fine. There's going to be people out there who have 8 C-sections and it was a wonderful experience and they didn't suffer any bad side effects. That's great. But the truth is, the risks of a C-section are higher statistically than the risks of a vaginal birth. So, you do with that information when you want to do with that information. But I just, oh my gosh. I really didn't want to rant like this, and now I'm like, should I even post this video? But I feel like I need to. I feel like I do need to, because I feel like you need to know that if you believe in your body and you are educated and informed and you're making decisions, you're not making decisions based off fear, you're not making decisions based off pride, you're not making decisions based off somebody else's fears, you're making decisions based off information that you have collected, digested, asked for, really mulled over, and you're using your educated brain to decide that a VBAC is the best choice for you, then you're a good candidate for VBAC. Now, that being said, is it best for you to have your VBAC in the hospital or at home? I should probably make a whole other video on that, honestly, and maybe I will. But I personally feel that if you have some of these higher risk factors for a more risky, I'm using these terms because I don't have other words, but for a more risky VBAC, then being in a hospital might be a better course of action. For other people, being at home is going to be the better course of action because you're eliminating other risks. Like, birth is a giant risk-benefit assessment, and what is a risk to you and a concern to you is going to be different for somebody else. And I feel like we talk about that a lot, and I'm just like rambling right now, and like this is so unlike me. Guys, I hope you're like sticking with me here. I'm just ranting. Yes, you can attempt a VBAC. Unless you have, okay, the only time I would say do not attempt a VBAC at all is if you have like placenta accreta or placenta previa, you know, like serious issues where a vaginal birth just like is not physically possible or smart, then you might not be a great candidate for VBAC. But for most situations, like if you really want to have a VBAC, do your research. Do your research and find out what you need in order to have a VBAC. Like your personal situation. What do you need to do to prepare for a VBAC and do that? All right, so now that I've yelled at you guys, I'm not yelling at you, obviously, but now that I've yelled about VBACs and the system and blah, 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 and rules, I want you to know that I'm here for you. And if you want any one-on-one virtual support preparing for your VBAC, I'm your girl. I'm here. Go ahead and reach out to me, and I'm happy to talk to you and help you process it and help you prepare for your VBAC. I have a few classes you might be interested in. Like, I'm working on more classes, and I want to give you all the materials for VBAC. So go ahead, ask your questions in the comments. Ask your VBAC questions in the comments. If you liked the video, hitting like is super helpful for me because it helps more people see my videos, and it helps more people, like, it helps me be able to keep doing this for you guys, and it helps more people benefit from these conversations. Look, I'm even like a mess. Like, my office is a mess today. I'm just like, whatever. I'm just going to go crazy, yell about VBACs, have a mess, whatever. And if you want to subscribe to my channel so that you can get more updates, more birth tips, breastfeeding tricks, new momhood tips, me ranting about VBACs. If you enjoyed that, hit subscribe. And I'm happy to see you every week to rant or not rant and answer your questions. That's what I really want to do. I really want to answer your guys' questions. So ask them. Ask the questions. Follow me on Instagram, Little Bear Birth Services on Instagram and Facebook. And I have a brand new Facebook group for you guys. It's the Confident Mama Bears Facebook group. So go join that right now so that we can build a community where we just support each other and find our own confidence. Like, I love nothing more than seeing moms totally confident. And sometimes we find that confidence and we find our voices by talking to each other and lifting each other up. So I just want that community. So I'm working on it. So come join it. Come join it. Okay, I'm going to stop yelling at you now. I'm going to go. And I want you guys to have a great day.